Hi, this is your own Dr. Shruti Ugran. I present to you another new podcast from our podcast series in the Pink of Health. Today, in this episode, we are going to discuss about breast health and women. This is one of the burning topics today, not just in medical sciences, but also in the wellness industry as well as other holistic and alternative medicines. We have one of the experts with us, Dr. Suvarna, who is going to break your myths. She is going to answer all your queries that you had sent to us, and I hope you guys have fun as much as we had fun shooting this podcast. Also, stay tuned till the end for some interesting discussions and some interesting discoveries. So, let's roll. Today, we are going to discuss about breast health issues related to women and how women can know more about their breasts and the issues related to it. For this discussion, we have the super amazing and the super talented Dr. Suvarna Kulkarni with us. Dr. Suvarna is an oncosurgeon with special interest in breast oncosurgery, and she is one of the leading practitioners in Mumbai. Hi, Dr. Suvarna.
Hello, Dr. Shruti. Hello, everyone. I'm Dr. Suvarna Kulkarni. I'm an oncosurgeon. I'm basically a surgeon who is specifically trained to deal with surgeries for cancer, all kinds of cancers. And I practice here in Navi Mumbai.
Dr. Suvarna, can you tell us a little more about about yourself? What developed your interest in oncosurgery, and why do you think that breast oncosurgery is one of the upcoming branches, and why do you love it so much?
Okay, so oncosurgery, why? One, because it is one of the diseases which don't have a complete treatment up till now. Most of the other things do have a good prognosis, so it is a field of constant research. And breast cancer, for one reason, it's the most common cancer amongst women. In India, almost 1 in 64 women in the city develop breast cancer in their lifetime.
That's a huge number. Is it the same elsewhere, or is it more in India or less in India? Like, what is it?
It is less in India compared to the other developed countries. In the states to compare, less to state, about 1 in 8 women develop breast cancer in their lifetime. But in India, by the sheer population number, we lead to quite number of breast cancers cases.
Right. I would discussing about breast cancer. I think we will leave it to the end. I would first like you to let our viewers know, because we got a lot of questions from them to begin with, that what kind of diseases does the breast have per se? Is it a lot of diseases other than cancer, or is it most of them are cancer, and that's why people are scared of the C word? What is your take on that?
So the thing is that obviously cancer is the rare amongst the diseases that the breast can have. Both the developmental, benign, and C word. Of course, C word, the cancer also, if caught early, is completely treatable. So to begin with, we can have multiple benign diseases in the breast. Depending upon the age of the patient, the types of diseases also change. So for women between 20 and 30 years of age, we have more, so teenagers to 30 years of age, more of fibroadenomas. These are just also called as mouse in the breast. These are just...
Why? So that's like so funny. What do you mean mouse in the breast?
Okay, when the clinician feels the breast, it just randomly moves around in the breast. There is no firm place where it stays, so it feels like a mouse in the breast.
It's made out of muscle, or it's...
No, it's just made up out of fat and breast tissue.
Okay, so the breast tissue is majorly made of fat. The content is mainly fat.
Yes, keeps on changing with the age of the patient.
Okay. Can you elaborate more on that?
So at a young age, let's divide it into before the menopause and after the menopause. So before the menopause, it is more of breast glands and less of fat.
Okay.
And after menopause, the gland tissue goes on reducing and the fat proportion goes on increasing.
Okay, because probably the function of the glands has been done by the time the woman attains menopause.
Correct, yes.
Okay. It's wonderful how nature takes care of everything in our body. You were telling us about breast diseases in various age groups.
So different age groups will have different diseases, like I already said. So just at the time when a girl attains her maturity, there could be just a benign enlargement of the breast, where the buds have increased in size. But people still around 13 and 14 years of age, the girl child's parents still get scared. What is happening with my daughter? Karke. And then we have fibroadenomas. We have, like I said, mouse in the breast. Then we have multiple fistula or a fibroadenosis disease, ductectasias. And as the age of the person increases, the tendency to have breast cancer as a lump than a benign breast disease increases.
If you were to say in one word or one age from where the risk of breast cancer would increase, what would be that age?
40. To
40.
be precise.
And does that mean that the chances that someone who's less than 40 has very less chance of getting cancer breast?
Yes, compared to a person, very rare scenario where the patient already has a very strong family history where they have breast cancer in their family, then unlikely a person below 40 will have breast cancer, along as a breast cancer in the breast.
I would say that is some respite for someone who is less than 40 years of age.
There are many women who get scared suddenly. They find one small lump in the breast and they suddenly get scared that it is breast cancer because somebody they know has breast cancer. Everybody these days has somebody suffering from breast cancer in their family.
I like the fact of how you made that statement as a general statement, and it is just lovely because everyone is so scared of the C word that they are just jumping all around if they find a lump in the breast.
And getting over investigated maybe.
Yes, probably. More on that, more to come as we roll. So the non-cancer breast lumps or the breast diseases that you were telling, how common are they in general in women? Are they more common than cancer breast, or?
They are more common than cancer breast.
Okay.
So there are again making it more scientific, multiple studies that quote that around 20% of the women have some kind of a benign breast disease.
So if you take 100 women, almost 20 will have some
sort
disease,
of a breast.
Most of which will be non-cancerous.
Correct.
That's good to know. Usually, what will the lady feel like? Like, is it diagnosed by a doctor on a routine health checkup, or is the woman herself aware of it, or how do they come to know about it?
So it also depends on what the woman is complaining of. So the woman can complain of just a pain in the breast, a particular region of the breast. She will notice whether it is coming with her periods or just generally coming randomly.
Right. So it's very much related to periods. That's one thing that someone should remember about.
Then there could be some say fluid secretions from the ducts of the breast, from the nipple areola in the breast. That could again depend on the woman can notice a different colors. Can be white, yellow, brown, black, greenish. A woman can notice that. Women can notice a lump a mass in the breast. Maybe a few skin changes on the skin of the breast. So putting all this together, all these findings together, the doctor will be able to give a fair idea about what could be the cause of the cause of the symptoms that the woman has, complaints that the woman has.
As we did a short survey about breast diseases that in general people know on various social media platforms, we did get an idea that a lot of people feel more confused. They know that they have some problem in their breast, but they're more confused whom to approach. Should I approach my family doctor? Should I approach a gynecologist? Should I approach directly a cancer surgeon? And if someone suggests that that is not always their first choice, or should it be a breast surgeon in particular? So what is your take on that, depending on how the patient would be comfortable?
A basic diagnosis, any of the above mentioned people can do. As far as they're a clinician who are experienced enough, a family physician, general physician, a general surgeon, a gynecologist, a cancer surgeon, anybody can be approached. Uh, Depending upon what that doctor clinically feels, they will refer accordingly. If the doctor feels that it is a cancer, so they'll directly send to a cancer surgeon, or if it turns out to be an abscess, a general surgeon will be able to manage it, or a fibroadenoma. So a patient should just go to a doctor and
Right.
get themselves
that is the bottom
examined.
line
Yeah,
here.
that is the
that
bottom
they
line.
have to seek medical care and they cannot not do that to themselves. Right. And also, are there any particular people in the population or women with any factors who might develop these breast lumps or any nipple discharge? Anything in particular, like are they on any medications or anything else?
The benign, not per se. Not per
So
se.
anyone
can develop. Yeah.
Right. Dr. Suvarna, here we would like to know that if suppose someone has any breast lump or any nipple discharge and they have visited their family doctor and their doctor has advised certain kind of investigations or uh, any kind of sonographies for them. So what do they expect? Like what is going to happen to them? Like what kind of investigations would they be going through, and whether they should be worried, they should not be worried? What should they do about all of this?
So the first investigation that any clinician at any level might ask for, a sonography of the breast, would be a screening tool. Depending upon the reports of that test, the woman can expect either a mammography to be asked further, or maybe a MRI of the breast.
Okay. And usually, suppose the sonogram or the MRI shows some breast lump, do they always need to undergo surgery, or there are any other methods to deal with it?
So, like we discussed previously, a lump in the breast may not necessarily be a breast cancer. So, a clinician will advise the patient to undergo a biopsy, which is a small OPD based procedure, happens under local anesthesia, that gives us a fair idea about what the woman is suffering from. So, depending on that, a joint decision, an informed decision can be taken by the patient and the doctor whether to observe the lump or to operate on it.
Okay. So there are some breast lumps which just nothing needs to be done. You have to just keep an eye on them. You along with the doctor have to keep an eye on them.
So a fibroadenoma, to be specific, if it is small, it can be observed. It need not necessarily be operated on.
Okay. That sounds like good news.
Yes.
Yeah.
Not every lump is surgery.
Okay. And other than removing the lump, are there any other surgical options?
So depending upon what the woman has, the type of treatment will change. If they have fibrocystic disease, it is a complete medical line of management. If they have breast cysts, which can present as masses, can be managed with syringe puncture also, or observed. If they have fibroadenomas, like I said, smaller fibroadenomas can be observed, bigger ones can be operated. Again, a joint decision between the surgeon and the patient. Axillary tail of breast. This is a very common thing, where they present as lumps in both the armpits, both or a single side arm. So that is purely a cosmetic surgery, wherein it is normal breast tissue that has grown and presenting as lumps in the armpit.
It's quite interesting about how there are various kinds of lumps in the breast, various diseases of the breast, and there are various treatment options, right from just medicines to just observing every year or every 6 monthly, probably, if I'm right.
Yes, correct.
Yeah, and sometimes just removing the lump, getting rid of it, or even something nothing to do but getting a cosmetic surgery.
Correct.
So it looks like a wide spectrum that all of us have, and I don't think there is a need to push the panic button when we hear of a lump, and in our heads we think it is always cancer. What is your
Definitely
take
not.
on that? Yeah.
If you have a good, you go to a clinician and get it tested properly. Need not press a panic button on all the lumps. They can just turn out to be something very benign.
Okay, that is
or some normal breast tissue in the wrong place also, maybe.
Dr. Suvarna, can you tell us that what are some of the red flag signs that if a woman feels that she has a lump or a discharge in the breast and she herself notices it, and she watched a podcast and she got inspired and she hasn't pressed the panic button, and but then still, are there any things that she should keep in mind that might indicate that she definitely needs to see a doctor or she needs to see a doctor urgently? What would you say?
So any lump in the breast which is painless, any discharge from the fluid coming out of the breast which is red in color, any lump in the armpit with a lump in the breast, any changes in the skin of the breast, any changes in the nipple and areola on the breast. These are some of the red flags. Sudden onset changes. Not some women have inverted nipples, so that is not a red flag sign. But sudden change in the position of the nipple, yes, we need to go and see the clinician there.
So when you say red flag signs, Dr. Suvarna, you are saying that there is a teeny tiny chance that they might have cancer or it might look like cancer, and she needs to further investigate it, right?
Yes.
So who are these kind of women that might have these red flag signs, or we as doctors expect to see red flag signs in these women? Who are these women?
So let's call these women as having more being at a higher risk of having cancer compared to the other women around. So these are women who have relatives having, or first degree relatives having breast cancer or uterine cancers. First degree relatives meaning mothers, sisters, their own real sisters would be their first degree relatives. Women who have an early start of their periods in their life, which we call the menarche, before 12 years of age. Women who are having children later in life, after 30, puts them at a higher risk of having breast cancer. Women who have chosen not to breastfeed or have not breastfed their children for some reason. Women who have taken oral contraception pills or hormone replacement therapy, any form of hormone therapy, for more than 5 to 10 years at a stretch are at a risk factor of having breast cancer. Just not women, but also men are at a risk of having breast cancer. Almost 2% of men have breast cancer in their lifetime.
So are you saying anyone with a breast tissue has a tendency to develop cancer?
Yes, correct. And men would be having more advanced disease compared to women, because the tissue between their muscle mass and the skin is less compared to the women.
And are there any particular high risk in men as well, like it is in women, or it is just blanket any man can develop breast cancer kind of a thing?
Tobacco usage, alcohol usage, there for both the genders, not only women or men. Men who have family history of breast cancer in their families, and that's more or less the same factors as women.
Dr. Suvarna, I'm going to put you here on a spot and I'm going to ask you that suppose a woman observes red flag signs in herself, or her family doctor points out that there are red flag signs. Who is the next best doctor that she can consult, or who would be the best to guide her about what is to be done next?
So I would really like to say an oncosurgeon would be the best person to guide them the next. But yes, everyone's not available everywhere all the time. So the woman can go to a general surgeon or a gynecologist. The important take-home message here that the woman needs to go to a doctor and needs to be diagnosed early, so that the right kind of treatment can be started early. So that would lead to best outcomes for that particular individual.
I would like to ask you that if a woman is suspected to have a cancer in her lump, what kind of scans or sonographies will she have to undergo? Is it same like non-cancer lumps, or is it different?
More or less it is the same. Most of the women would need a mammography or a MRI depending on the age, and a sonology would already have been done as a screening tool, and a biopsy for the final diagnosis. Generally, a clinical suspicion by a doctor, very rarely does it happen that it a benign some malignancy cancer wasn't suspected right from the beginning. So once a cancer is proved, just another 2-3 investigations would be may or may not be required depending on what the condition of the patient is.
So are you saying that whatever the lady has symptoms and whatever her primary doctor has diagnosed is more likely to be true, and investigations are just an add-on to confirm?
Correct.
Confirmation?
Investigations are only used to confirm. It is always the clinical diagnosis that matters.
So the take-home message here would be, if your doctor strongly thinks that it's non-cancer, just trust it and just get your investigations so that the woman can have a sigh of relief.
Correct,
right?
correct. Or the doctor feels it's cancer, then that's a red flag sign too.
So you mentioned biopsy. So what exactly do they do in biopsy? Because we had a question where someone felt that it sounds very scary and it looks very scary. So can you tell us in short, like what exactly is a biopsy?
So it's basically done on OPD basis. There is no need of admission for a biopsy. Local anesthesia will be given on the mass or the breast lump, and a needle goes into the mass and removes some amount of tissue that can be examined under the microscope by a histopathologist to confirm the diagnosis of malignancy or rule out the diagnosis of malignancy.
So it's just like a small bit of tissue that is taken out of your body,
yes,
and it
yes.
doesn't bleed, doesn't hurt.
It doesn't hurt, no.
Okay, okay. So moving ahead, that suppose if a lady is diagnosed of a cancer, what kind of treatment would she have to undergo? Is it always surgery? It is always chemo? Is it a mixture of the two, or what is it?
So the treatment is a mixture of 3 modalities of treatment depending upon the we call a stage of the cancer in the particular individual. It will be a combination of either surgery, chemotherapy, or radiation. So not everyone requires chemotherapy or radiation. It is just some individuals might require chemotherapy, some individuals might require radiation in addition to surgery. And yes, previously breast cancer implied a mastectomy. Now with the advances in science, it is possible to save the breast also, so that it gives a good cosmetic outcome later.
When you said that there could be a cosmetic correction, so what do you mean? Do you perform a cosmetic surgery, and if yes, then what exactly do we do over there?
So it does involve some form of a plastic surgery, either in form of a prosthesis or using the patient's own tissue to make the breast that is being treated for breast cancer to look like the opposite breast, so that the patient feels complete after the treatment of the breast cancer.
Okay, so is it a tissue from the patient's own body? Is it part from somewhere else, or is it a actual prosthesis?
So it may vary from patient to patient. It can either be tissue from the patient's body itself or a prosthesis that was used. That depends on the type of reconstruction that amount of tissue that is removed, that needs to be replaced also.
Okay, okay. Doctor, I would like to know that we have spoken so much about treatment and diagnosis, about cancer and so many things, visiting the doctor, importance of seeing your doctor very early. Having said all of that, is there anything that a woman in general can do to just stay away from this developing this lump, or prevent developing this lump, or even delay developing this lump by a few years? Can they do anything?
Having talked about the risk factors leading to breast cancer, some of the pointers that can be discussed would be leading a healthy lifestyle, avoiding addictions, avoiding use of tobacco or alcohol, keeping a physically active day-to-day life, exercising regularly, maintaining a normal weight, choosing to breastfeed, whenever going in for prolonged hormonal therapy in the form of oral contraceptive pills or hormone replacement therapy, consulting your doctor regularly. For women, these are some of some of the things that are there in our hands that can be actively done. For women who have a strong family history of breast cancer, having multiple women in their family suffering from breast cancer or ovarian cancer, can choose to know how much they are actually at risk for developing breast cancer. Simple way would be just get themselves tested. It's just a simple blood test that can give us the mutations in BRCA1, BRCA2 mutations that would give us a fair idea about how much the individual is at a risk of breast cancer. For everyone, there are a few pointers that can be shared to reduce or detect breast cancer early in themselves. Number one would to be do a monthly self breast examination, a yearly breast examination by a doctor, do a mammogram every 12 to 18 months, that is about 1 year to every 1 to 1.5 years. For women who have breast cancer or have already successfully undergone a treatment for breast cancer, can form support groups. Mental support also sometimes just helps to recover from a certain condition earlier. That's about it.
When we were discussing, you mentioned something about monthly
Self breast examination.
self breast examination. What can you throw some light on that?
So I have a model of a breast with me, so I will demonstrate on that. So this examination needs to be done by a woman on day 5 of her period every monthly. Here, even the armpit needs to be examined in this time.
Okay.
It is just a circular motion in which the entire breast needs to be examined. This is the breast and this is the nipple areola complex. So this is the circular motion. The woman can stand in front of a mirror and see for any differences between the two breasts, either in the size, the position of the nipple and the areola, any changes on the skin, any lumps that can be visible directly in the mirror. And with a circular motion and with firm pressure on the chest wall of her chest wall, feel for the entire breast and also the armpit, and make it a point to feel behind the nipple and the areola also. So if she does feel any lumps for herself, first she'll have to know how her normal breast feels like, so that detecting a lump will be easier, or any change in her breast will be easier.
Okay. And any a specific thing, like someone, if they have had a uterine surgery or they don't get their periods, have attained menopause, like how do they decide on a date of when they want to do this?
They can fix their let's say a monthly anniversary and do it, examine
like
it
a date every month, specific date every month,
then examine their breast on that day.
Okay. And this is to be done on both the breasts,
Yes,
right?
correct.
Yeah. You mentioned also that they have to examine their armpit. Can you explain to us more about that?
Some of the breast extends into the armpit, so a lump, if it has to be formed, it has an equal chance of forming there also. So even the armpit needs to be examined.
Okay. So, but then how important is this breast examination? Can they, if they feel there's some change, can they just go to the doctor and get it examined?
Yes. If there is a change, they need to immediately go to the doctor and get themselves examined.
Okay. You also mentioned that a lot of women will have to undergo mammogram. So can you tell us what exactly is a mammogram? Who has to undergo mammogram? What age is it? Is the mammogram painful? What exactly is done? And what kind of result does one expect on a mammogram? Like throw some light on mammogram per se.
Mammogram is generally advised after the age of 40 years of age, not before that. Uh, if a mass has to be investigated before that, a MRI breast would be done rather than a mammogram. It's basically X-ray of the breast and not painful. Yes, everyone is scared whether it is painful or, but it is not painful. And so it even before a cancer shows up as a lump, the changes in the breast are known to occur almost 3 to 5 years before the breast lump actually shows up, and these are detected by the mammogram. So detecting in this early stage, early treatment, better results, like we already discussed.
Can you tell us that you did happen to mention something about cancer support groups? So, how exactly do these groups work, and what kind of people are involved in this, and how do they help someone? Like, we all know that, like support groups are useful, but then cancer specific support groups. Can you tell us more on that?
So it's basically like a friend helping a friend. So a person, everyone's scared of, if a patient comes with breast cancer, comes to me, she would be asking me, would radiation affect her day-to-day life? Is breast conservation actually feasible? Is chemotherapy going to affect her life, or in what way are they going to be affecting? So me being a clinician me being a doctor I will always give the positive side, but the patient has suffered through it, so they are better advocates about the treatment. So as a doctor, I can look at the medical part of it, like the chemotherapy, the radiotherapy, the surgery, the exercise that needs to be that needs to be dealt with for the recovery. But the emotional, mental part of it, I may not give the complete treatment to it. So a person who's already gone through it or has as a near and a dear one suffering through it will be at a better position to give that. So that is the entire idea of the support group. So it's like a holistic treatment. They also actively work in creating awareness nationally, internationally, locally, on all levels. That is why I think October has been celebrated as International Breast Cancer Awareness Month since 1992.
Right, pinktober, as it is
Pinktober,
called.
yes.
Yes. So that was a quite an excellent and amazing discussion. But we come towards the end of our podcast and our discussion, and this is what is the fun element. This is a rapid fire round where I am going to be asking you some very quick, very easy questions, and most of these questions are from our viewers and our followers from social media. They are questions that they want one word answers to.
Okay.
So I would like you to answer as right or wrong. Are you ready for the rapid fire?
Okay, fine.
Yes, we are here busting myths. Are you ready for this?
Yes.
Yes.
I'm also scared. Okay, fine. Let's go.
So, all lumps in the breast have a potential to develop cancer.
Wrong.
Injury or trauma to the breast always causes cancer.
Wrong.
Cancer of the breast is always painless.
Wrong.
If my mother or aunt had breast cancer, I will definitely have one.
Wrong.
Men can also get breast cancer.
Correct.
Wearing an underwire can cause breast cancer.
Wrong.
Women under 40 can also get breast cancer.
Correct.
Breast cancer is like a death sentence.
Wrong. Absolutely wrong.
If I have breast cancer, I definitely will need chemotherapy.
Wrong.
If I need chemotherapy, I'll definitely need radiotherapy.
Wrong.
IVF or any other fertility treatment increase my chances of breast cancer.
Wrong.
If I have an armpit pain or an armpit lump, it is definitely related to breast cancer.
Wrong.
Obesity increases my chances of breast cancer and other breast diseases.
Correct.
No one in my family had any kind of cancer, so I will never have any cancer.
Wrong.
If there is no lump in my breast, there is no cancer.
Wrong.
Mammograms can cause breast cancer to spread if done very frequently.
Wrong.
That brings us to the end of a rapid fire round. I hope there were some amazing take home messages from our rapid fire. Dr. Suvarna, I am very thankful to you for taking out time and joining us today to discuss more on breast cancer and breast awareness and about various breast diseases. I am sure that everyone has learnt a lot. They have cleared most of their doubts, and they have learned something the fun way. I'm very sure about that.
Thank you, Dr. Shruti. Thank you very much for your generous invitation. I definitely had a lot of fun.
Yes. I'm sure that you all had a lot of fun and learnt about medical conditions and about benign as well as cancer breast diseases in a very fun way. Me as well as Dr. Suvarna had an amazing time shooting this podcast as well. And I intend to having many more medical podcasts which are related to women's health and wellness. In case you have any suggestions or you have any topics that you would like us to cover, please let us know in the comment section. Also, keep watching this space for more such interesting and fun related learning. If you liked what we are doing, do subscribe to my channel and keep watching more. Thank you.